A very good evening to everyone. This is Shubham. Welcome back to my channel Medical Concepts. So in this video we are going to start with the cardiovascular system. So let's dive into it. Question number 100. Autopsy of a dead man who used to have atherosclerosis has shown a thrombosis of internal carotid artery, okay, and a gray focus of humid encephalomalacia, okay, or encephalomalacia, whatever you want to call it. What pathological process is diagnosed in the brain? So guys, question is very straightforward. As you can see that there was the autopsy done of a dead man, and atherosclerosis was the finding over there. You know the atherosclerosis, atheroscleromatous plaque, cholesterol plaque will be deposited in the blood vessel, and they usually cause the obstruction, okay, you know these kind of things. So has shown a thrombosis of internal carotid artery. Now internal carotid artery is very important for the blood circulation of the brain, right? So it is actually a very important artery, right? If there is some kind of obstruction, if there is some kind of atherosclerosis, if there is some kind of cholesterol plaque deposited in this artery, or some kind of thrombus will be deposited in this artery, it is very obvious to understand for us that it will be causing the ischemia inside the blood vessels, or you can say the ischemia inside the tissues of the brain especially, okay, which actually causes the formation of a gray focus of humid encephalomalacia. Now what is encephalomalacia? First of all, encephalomalacia is kind of a softening or loss of brain tissue after some kind of infarction. If they are saying encephalo means what? Encephalo means what? Brain. Cephalo means head, encephalo means brain. Malacia means softening, okay, softening of any kind of structure. So here the softening of the brain tissue will be happening. So encephalomalacia is a softening or loss of brain tissue after cerebral infarction. In this case, what particular thing is causing the cerebral infarction? What is infarction? First of all, infarction is some kind of a death of the tissues, particular tissues, right? So obvious, it is very obvious to understand that the infarction will be happening due to the ischemia over here, due to the plaque which is made up of atherosclerosis and the thrombus over here. So the answer of this question, they are saying that they are asking us what pathological process is diagnosed in the brain. That will be very easy for us to pick up over here, that it will be the ischemic infarction, okay. As I said, what is encephalomalacia? They actually mentioned the term encephalomalacia. This is the softening of the brain tissue after the cerebral infarction or after the cerebral ischemia, right? After the ischemia, infarction will be happening. So there's a ischemic infarction. I have inserted an image over here for the better understanding. So look on the right side, you can see the gross image, and in particular particularly in this portion, you can admire actually in this portion what you can see. This is the infarcted tissue, okay. Why is it having the infarction? Very easy to understand, that the internal carotid artery was having the thrombus or the atherosclerosis process, and due to that there was the infarction over here, and we can say encephalomalacia, right? That fancy term over here. On the left side you can see the MRI image, and over here in this particular image I can show you this particular portion, okay. So this is having the blackish kind of tissue, right? Blackish kind of color you can appreciate over here in this MRI image of the brain. So this is the encephalomalacia which is happening over here, cerebral infarction happening over here due to the obstruction in the internal carotid artery, okay. I hope you got my point. That was the easy one. Let's move on to the next question. Question number 101. Autopsy of a 69-year-old woman with overweight who died of acute MI, okay, acute myocardial infarction, has shown multiple whitish solid masses in the coronary intima, okay, fine. They bulge into the lumen and restrict it. What stage of atherosclerosis they are asking? What stage of atherosclerosis described? Now guys, we are having many stages of atherosclerosis on the basis of microscopical finding. I will put them in the notes in the description box below. You can give a read over there. However, I am just dictating, or I am just naming them verbally, okay. So there are particularly there are 6 stages. So there is, first one is the pre-lipid stage, then there will be the stage of fatty strips, which is having the lipoidosis, okay, or you can say stage of lipoidosis. Third one is the stage of liposclerosis. Fourth one is the stage of atheromatosis. Fifth one is stage of ulceration, and the last one, sixth one, is the stage of atherocalcinosis, okay. You can make your own notes while I'm talking about these ones, or you may give a read in the description box below. Fine. Look, I'm not going to talk about all of the stages over here, but I want to talk about the main one which is related to this particular question, because they are saying the main thing that after the acute MI, they gave the history of acute MI. First thing, this woman was overweight. Second thing, third thing is they said multiple whitish solid masses was found in the coronary intima. Third thing, and the last thing over here which they said that they bulge into the lumen. Okay, so that is enough for us to pick up the stage, which particular stage are they talking about as far as atherosclerosis is concerned. Okay, so in this particular question they are talking about the third stage, that was the stage of liposclerosis. Okay, now what happens in the stage of liposclerosis? Let me talk about that now. Look, guys, before the liposclerosis, actually there is the stage of lipoidosis or stage of fatty strips. This liposclerosis stage, third stage, is a continuation of the second stage, obviously, right? What happens is that whenever there is a death of some kind of tissues, why I'm saying death of some kind of tissues, in this case I am related to the acute MI. In the MI, you know that due to the ischemia, what will be happening to the cardiomyocytes? They will be undergoing the process of necrosis, right? So after the death of those cardiomyocytes, or after the death of those tissues of the heart, what will be happening? There will be the accumulation of cytokines. Which kind of cytokines am I talking about? I'm talking about the monocytes, macrophages, and some other kind of cytokines will be resembling over there, will be accumulated over there. And what they will cause? They will cause the proliferation, they will stimulate the proliferation of the smooth muscle cells. Okay, and their ingrowth into the intima will be starting from the tunica media. Let's say, I hope that you are aware about the layers of the layers of the tissues we are having, or layers of the blood vessels, I can say. You must be aware from the histology that we are having the tunica externa, tunica media, then tunica intima. Now tunica media is the middle layer, tunica intima is the innermost layer. What happens is that whenever there is some kind of death of the tissues, cytokines will be accumulating over there. After the accumulation of the cytokines, what they will be doing over there, that they will be stimulating the proliferation of smooth muscle cells. Now what will be happening then from the tunica media? Look, let's say that okay, this is a very simple diagram. Okay, so look guys, let's say this is the tunica media. Okay, and this is the tunica intima, this is the tunica intima, let's say tunica intima. Okay, I denotes tunica intima. What happens is that proliferation of these cells, proliferation of these cells will be happening due to the stimulation of cytokines. Cytokines will be stimulating. Okay, and what caused that? Death of the tissues, necrosis. Okay, what causes necrosis? Ischemia. In our question, necrosis means MI. Okay, I hope this is making the sense over here. So necrosis will be stimulating the cytokines. Which cytokines I'm talking about? Macrophages, right? Macrophages, along with that monocyte actually will be jumping into the tissues, then they will be converting themselves into the macrophages, right? So macrophages, neutrophils can be there. Okay, so I can write neutrophils over there. Okay, so these kinds of cytokines, they will be stimulating the proliferation of these kind of smooth muscle cells into the lumen, of the, this is the lumen guys, isn't it? This is the lumen of the tunica intima, into the lumen of the, so they will stimulate the proliferation of the smooth muscle cells. Okay, these are what? These are the smooth muscle cells. Okay, smooth muscle cells, they will be causing the proliferation of the smooth muscle cells from the tunica media into the lumen of the tunica intima. Okay, that whole process, I'm talking about the liposclerosis. What is the process over here which I'm talking about? There is the liposclerosis. Okay, liposclerosis. And this this mass which I'm talking about over here, which was actually coming into the lumen of the intima, this mass is actually called as fibrous cap. So this structure is called as fibrous cap. Okay, it will be making much more sense whenever you will be giving a reading yourself from the notes. Okay, so this is a fibrous cap. I hope you are clear till now. So that is called as a fibrous cap. Let me repeat once again what was happening. Ischemia will be causing the necrosis. In our case, they gave the case of acute myocardial infarction. So myocardial infarction, you are very well aware about that there will be the necrosis of the cardiomyocyte. They will cause the stimulation of the cytokines. That is, in our case, that will be the macrophages and neutrophils and all these kind of cytokines. They will stimulate the proliferation of smooth muscle cells present in the tunica media, and that proliferation of the smooth muscle cells will be actually exaggerating into the lumen of the tunica intima, and after that particular structure we are calling that as fibrous cap. Okay, so this proliferation of smooth muscle cells, we are calling that as fibrous cap. Now this whole process which I am talking about over here is the liposclerosis. So what will be our answer? What stage of atherosclerosis I am talking about? So that will be the liposclerosis. So I hope you are clear till now. Okay, so that is the liposclerosis. Fine. Okay, enough about this question. Let's move on to the next one. 102. Histological examination of the aorta wall has shown a great amount of xanthoma cells or xanthoma cells. Okay, whatever you want to call it, mostly located in the intima, means like tunica intima, innermost layer of the blood vessel. What are the following changes typical of? So it's very easy. Xanthoma cells are the characteristic finding of the atherosclerosis. Now you know the process of atherosclerosis. Okay, cholesterol plaque, lipid, LDL, you know, bad cholesterol, LDL. However, nowadays we are not calling that as bad cholesterol according to the latest guidelines. So atherosclerosis. Okay, so cholesterol plaque will be depositing in the blood vessel. Now xanthoma cells are kind of cells which they are containing fat inside them. I can say they are kind of a bad cells because they are containing the fat inside them. We are also calling them as foam cells. Foam, you know, you must have seen the foam kind of thing, you know, it is having the sponge, you can say it is having that fatty kind of substance inside it. So xanthoma is a kind of harmless growth of a tissue. However, it is harmless, but if it will be present in the intima of the blood vessel, then obviously it will start causing the obstruction in the blood flow, right? So it will be harmful at that time. So under the microscope, a xanthoma is having the having the composition of the lipid laden foam cells. Okay, lipid laden foam cells, and these cells we are also calling them as histiocyte. They are containing the lipid material inside them. So if I am talking about lipid material, if I am talking about foam cells, these are the xanthoma cells, the fancy name. So this is actually related to which kind of process? That is the atherosclerosis. Okay, I hope I am clear with this one. 103. A patient with hypertensive disease was diagnosed with long-term hypertensive crisis. Name the pathomorphological changes in the arterial walls during the hypertensive crisis. Okay, now hypertension is different thing, hypertensive crisis is different thing. Hypertensive crisis means like the patient, first of all the patient will be having the pre-hypertension, then patient will be having the mild hypertension, then moderate hypertension, then severe hypertension, and then the last stage is the hypertensive crisis, which means this is the fatal situation and the patient may lose the life. Okay, that much increased blood pressure, and the patient may have the organ failure in some cases, right? So hypertensive crisis is obviously very bad situation. So in this case, what will be happening? If I'm talking about hypertensive crisis, I'm talking about the blood vessels. Obviously, if I'm talking about blood vessel, which kind of necrosis will be seen? So if you know the process, you know the answer, bang on. So over here they are talking about themselves, they said that they are talking about the arterial walls, and you know obviously that hypertensive crisis, they are talking about the arterial, they are talking about the blood vessel. So which kind of pathomorphologic changes they are talking about? So that is the fibrinoid changes. Now let me talk about fibrinoid changes, fibrinoid necrosis you can say, or fibrinoid changes. So it is a specific pattern of the irreversible damage. Okay, uncontrolled cell death will be seen over here, because you know hypertensive crisis, the pressure which will be exerting on the blood vessel, they will not be able to bear it actually, and they might rupture. Okay, so that irreversible specific pattern will be can be appreciated in the fibrinoid necrosis. Okay, and what will be happening, antigen antibody complexes will be deposited in the walls of blood vessels along with the fibrin formation here and there in the blood vessel. Okay, so if I'm talking about antigen antibody complex, you know very well from the general pathology concept about the immune process concept from the pathology, that if I'm talking about immune complex formation, I'm talking about which kind of hypersensitivity. Yes, that is the type 3 hypersensitivity reaction. So if they will be asking you fibrinoid necrosis will be related to which kind of hypersensitivity, then your answer will be the type 3 hypersensitivity reaction. Okay, other kind of examples, you know that SLE for an example, that can be the classical example of the type 3 hypersensitivity as well. Okay, so fibrinoid necrosis will be seen as a specific pattern of irreversible uncontrolled cell death, you can say, will be happening inside the blood vessels, and that is related to the formation of the immune complex deposition in the walls of the blood vessel. Okay, mainly seen in where, in the hypertensive crisis. So whenever you are talking about the blood vessels, okay, then if they're asking related to the blood vessels and they want to know which kind of necrosis will be there, then that will be the fibrinoid necrosis, because immune complex deposition will be seen in the walls of the blood vessels along with the formation of fibrin. Okay, so that's why the fibrinoid necrosis. Okay, I hope you got this point. 104. A 60-year-old man has been ill with essential hypertension for a long time, died of chronic renal insufficiency. Autopsy has shown that both kidneys are considerably decreased in size. Guys, let me tell you that if the person kidney is not having the proper blood supply, or if the kidneys are not getting proper blood supply for a longer period of time, we will be calling that as chronic renal insufficiency, because insufficiency of blood, right, as far as kidneys are concerned. So chronic renal insufficiency, if the kidneys will not be getting the blood supply, then the size of the kidneys will start to shrunken. Okay, that is the main thing. So they will be start getting the contractions. So contracted kidneys, the proper term which we will be using for them, because obviously if you are not giving water to the plants, what will be happening to the plants? They will start to shrunk the size, right? So the same thing which will be happening over here. So very obvious to think about that if the kidneys will not be getting its proper blood supply for a longer period of time, if that is happening for shorter period of time, they can compensate themselves obviously, but for a longer period of time, I'm talking about the chronic cases, so the kidney size will start to shrunk, and that case will be called as a contracted kidney. And along with that, there can be the granular changes. I will be showing you the image as well of those kidneys, so you can easily compare the size of both the kidneys. Okay, and the weight of the kidneys will drastically becomes low, and sometimes it can go low up to the 50 grams. Okay, and that actually very low weight, right? So autopsy shown that both kidneys were considerably decreased in their size. Surface are fine grained, which, as I said, that the chronic renal insufficiency, fine grained and contracted kidneys will be seen over here. Histologically, they said the majority of the glomeruli was hyalinized, part of them sclerosed, and some of them hyperplastic, right? Stroma had the areas of necrosis, arteriolo and arteriosclerosis, elastofibrosis of large branches of renal arteries. So definitely the kidney is not having a good time over there, isn't it? So what kind of changes you will be appreciating over there? Look guys, these kind of questions looks very big, but actually they are easy at the same time. So this kind of question will be appearing in your exam just to waste more and more amount of time, and every aspirant will be reading this question at least 3-4 times. Okay, and this will lead to the wasting of the time actually. So the answer they gave themselves in the question itself. Look over here, they said that the kidney was having the chronic renal insufficiency. Along with that, they said that the stroma had the areas of necrosis and arteriolo and arteriosclerosis. Okay, as far as this kidney's blood vessels are concerned, and they said that the kidney was having the fine grained surface, the kidneys was considerably decreased, and they said that part of the kidneys was sclerosed, hyalinized. Okay, so these kind of things they gave you. Hyperplastic. Okay, look at the options: arteriosclerotic kidney, arterionephrosclerosis. Okay, A option can be there, B option can be the answer, because they said that nephrosclerosis, sclerosed kidney was sclerosed. Okay, nephrosclerosis, Nephron means nephrons are present in the kidney, right? They're the basic structure and function unit of the kidneys are the nephrons. 1.2 million nephrons are present as far as numbers are concerned over there in the one kidney. Glomerulonephritis, pyelonephritis, they didn't mention about much about that. And last option, look, they said both the things. First thing was sclerosed, second thing was atherosclerosis. So we can combine both the things. So nephro, as it is happening inside the kidney, can I say that nephrosclerosis? Yes, nephrosclerosis. Arteriosclerosis, it themselves mentioned about that. So the correct answer over here will be the arteriosclerotic nephrosclerosis, isn't it? So that's the case. Next question is, a 67-year-old patient had essential hypertension for 20 years, very long period of time, and died of chronic renal insufficiency. How did the kidneys look at the autopsy? I told you guys that if the patient will be having the chronic renal insufficiency, the size of the kidneys will actually start to get very decreased. Okay, so I can say the shrunken kidneys will be seen, contracted kidneys will be seen. So only one option there, you can see the D option, that little kidneys they are talking about, little solid with a fine grained surface. Okay, so that is the D option over here, which will be the correct one. Chronic insufficiency will lead to the contracted, little, solid with the fine grained surface kidneys will be seen over there. Next question is, autopsy of a man who died of essential hypertension. Complications has shown small, solid kidneys, right? Essential hypertension with fine grained surface, atrophic parenchyma, obviously, and cortical substance. Name these kidneys. Okay, so I told you, solid, small solid kidneys, fine grained surface. When you can appreciate them, whenever there will be the chronic renal insufficiency. But they said name these kidneys, so I told you the specific term, that will be the shrunken kidneys or the contracted kidney. So answer over here will be the contracted kidney. Now let me talk about the image over here. Okay, you can compare the two kidneys over here. Okay, look at this one. So you can see the smaller kidney. First of all, this is the small kidney, right? Smaller in size. Then if you can appreciate, this might be blurred to you, but it is having the granular surface, as you can see from the gross section over here. This is the granular surface. So here you might appreciate the granularity. Okay, granularity. Okay, here you might appreciate the granularity, and it is the smaller in size. Fine. And sometimes the weight might go up to the 50 grams. Okay, weight might go up to the 50 grams. Okay, sometimes there can be many things like chronic renal insufficiency can be there. Sometimes there can be the infectious causes, for example chronic pyelonephritis can be there, chronic glomerulonephritis can be there. In case of chronic glomerulonephritis, look, they said in this particular question that they mentioned about the essential hypertension component. So due to the essential hypertension, then the patient are having the small solid kidneys. So sometimes both the kidneys, sometimes it can be unilateral, sometimes it can be the bilateral case. But if they're talking about the bilateral kidneys involvement, okay, then most of the time this is the involvement of the chronic glomerulonephritis. Okay, so keep that in mind as well. Fine. And the thing is, in the chronic glomerulonephritis, if these kind of changes are appearing, then we say we call them as secondary shrinkage of kidneys. Okay, so keep that in mind as well. Now let's talk about the next question, that is a 107. Autopsy of a man who died of pulmonary edema has shown a big yellow gray focus in the myocardium and fresh thrombus in the coronaria or coronary artery simply. Okay, or coronary vessel. Specify the diagnosis. Very easy question, guys. Pulmonary edema was there, big yellow gray focus in the myocardium they said, and fresh thrombus in the coronary they said. So that is the classical case of the myocardial infarction they are talking about. So answer will be very clear, MI. Okay, myocardial infarction. Now what they said, that there was the fresh thrombus in the coronary, as you can let's say that this is the coronary vessel, and you can see the blocked artery, right, thanks to atherosclerosis. So this is the case of blocked artery, and due to this blocked artery there will be the ischemia, and if there will be ischemia, obviously the heart muscles will be damaged over there. Okay, no doubt about that. And you can see the necrotic area you might appreciate in this particular portion, isn't it? So that is the case over here. So in that case they said that big yellow gray focus. Big yellow gray focus will be seen over here due to the ischemia, okay, due to the necrosis which will be happening over that particular area. Okay, if this ischemia will not be resolved for a longer time, then this area will be actually getting bigger and bigger and bigger. Okay, and the person's morbidity rate will be increasing, and the chances of mortality will be increasing as well. Okay, obviously. Okay, so I hope you got my point. So that is the case over here. By the way, why there will be the pulmonary edema over here in this question, in this case, guys? Very easy to understand for us, that if the there is a myocardial infarction, blood will not be able to come out from the left ventricle, which means that blood will not be able to pump the blood, right? If there will be no pumping of the blood, what will be happening? Systolic BP will be start to drop, cardiac output will be dropping, there will be the accumulation of the blood in the left ventricle. If there will be more and more accumulation of the blood in the left ventricle, it will go back into the left atrium, and then from there it will start to go back into the lungs through the pulmonary veins. So that will cause the pulmonary edema, and finally that will cause the pulmonary hypertension as well. Okay, so that is the case over here. I hope you got my point. Let's talk about the next one. 108. A patient with myocardial infarction has signs of blood circulation insufficiency, cyanosis, subcutaneous fat edema of the lower extremities after physical activity. What morphological changes develop in the place of MI after the recovery? So in this particular case, this is the classical case of the cardiosclerosis. Look guys, the main point over here, the main catch is the myocardial infarction. Now in most of the cases, you must be noticing over here that they are talking about the MI. Okay, so most of the cases in the cardiovascular system, you will be dealing with the MI. So this patient also had the history of MI, and he had the signs of blood circulation insufficiency. Obviously, MI person will be having the insufficiency of the blood circulation, and cyanosis was seen, and subcutaneous fat edema in the lower extremities was appreciated after some kind of physical activity. Okay, why it will be happening? Due to the insufficiency of the blood circulation. Very easy to understand for us. But what morphological changes will be developing over there in place of myocardial infarction after the recovery? Okay, thanks to the God that this person had recovered. Okay, but that doesn't mean that this patient may not be having the attack later in the life. Okay, what is myocardial infarction? That is the heart attack, right? And you must be hearing about the things about heart attack, that in the movies or in some kind of serials and all these things, that the heart attacks usually the persons are actually able to compatible with their life with the first case of heart attack, then first episode of heart attack, then second episode of heart attack, but it is very difficult to actually survive the third heart attack, right? So that is the case. So let's say it was the first attack, and what changes will be seen in the myocardium after this MI, however the person has been recovered? So that is the sclerotic changes. Okay, isn't it? That is the sclerotic changes, and these sclerotic changes we are calling them as cardiosclerosis, as they are happening in the cardium, as they are happening in the cardiomyocyte. So these changes will be appreciated as the cardiosclerosis. Now let me tell you, there can be two kind of changes which can be seen as far as these cardiovascular events are concerned, cardiosclerosis is concerned. So look, one is the macroscopic change and one is the microscopic change. Macroscopic change, you can see over here that on the left side, let's say this is the left side and this is the right side. So in the left side diagram, you can see that everything is fine over here, but in the right side, okay, let's say that happened after the MI attack. Let's say that happened after the MI attack. What happened over here is that you can see the ventricle septum. Okay, between the two ventricles, the septum is having the bigger size over here, isn't it? The septum is having the bigger size. So what is actually happening? So guys, cardiosclerosis can be having the two major changes, okay, after the MI. Obviously that can be the macroscopic changes, and that can be the microscopic changes. On the macroscopic picture, what you can see, there can be the sclerosis, there can be the brown coloration of the heart, there can be the hypertrophy of the left ventricle, okay, and sometimes there can be the hypertrophy of the septum, ventricular septum, okay, as you can appreciate over here in this picture. So these are some of the macroscopical changes. What are the microscopical changes? Microscopical changes you cannot see from the naked eye. Okay, microscopic changes, they will be seen as the hypertrophy of the adjacent myocytes. Okay, or in other words, I can say that there can be the atrophy with the perinuclear deposition of the lipofuscin. Lipofuscin is a particular kind of substance, very particular. If they will be asking you the microscopic changes after the MI as far as cardiovascular is concerned, then your answer should be the lipofuscin accumulation. Lipofuscin accumulation. Okay, so that will be the microscopic change. So I'm writing it over here as well, that in the microscopic change, okay, microscopic change or examination, you will be finding over there lipofuscin. Okay, and macroscopic, as I said, left ventricular hypertrophy can be there, and there can be the brown coloration of the heart, there can be the hypertrophy of the ventricular septum. So these kind of changes might be appreciated. However, they didn't ask you the macro or microscopic changes, they simply ask you what is the condition, that is the cardiosclerosis. I hope you're clear with this one. Let's talk about the next question. Autopsy of a dead 58-year-old man shown a big gray pale focus of softened gray substance of a papy consistence in the right temporal lobe. Okay, numerous white yellow thickenings of intima means tunica intima of the blood vessel they are talking about, the sharply restrict the lumen, have been detected in the arteries of the base of the brain. So very easy to understand for us. So what is the diagnosis they are asking? Very easy to understand for us that they are talking about the big gray pale focus that was seen in the temporal lobe region, and what was the thing? Numerous white yellow thickenings of intima, right? So they are talking about the atherosclerotic case which is happening in the blood vessel of the one of the blood vessel of the brain, one of the artery of the brain. They didn't name which artery. Let's say it was some kind of carotid artery, or it can be another artery from the circle of Willis. But the thing is, the concept is same, that look at this picture over here. This was the blood vessel, okay, and what happened is that this, thanks to this atherosclerotic plaque, that this will cause the obstruction in the blood flow over here, and if there will be obstruction in the blood flow, it will lead to ischemia, and if there will be the ischemia, then this particular kind of surface you can see, there will be the gray kind of patch you might appreciate over there. So why the problem is there? Due to ischemia, right? So this is a case of ischemic stroke. There are two kinds of strokes: ischemic stroke, hemorrhagic stroke. The main difference is ischemic stroke will not be having the spillage of the blood. Hemorrhagic stroke is even far more dangerous, because in the hemorrhagic stroke, even the blood vessel will be leaking the blood from there, and then it will be spilling out from the blood vessel, and the person might underwent the condition of shock. Okay, for example, hemorrhagic or hypovolemic shock. So that is even worse. So this is the case of ischemic stroke. Fine. So I hope you're clear with this one. So that was the discussion of the cardiovascular system. I hope you enjoyed the discussion, and if you like the video, then please hit the like button. Make sure to subscribe the channel, make sure to share it with your friends, and I will see you in my next one. Thank you for your support, and thanks for watching this video. I will see you in my next one. Till then, take care. Until next time, bye.